Welcome to the Laser Therapy Institute weekly podcast, the world's first podcast about medical laser therapy for healthcare providers. Each week, we discuss the latest research, interviews with experts, and how laser therapy can enhance your practice. Now, here is the founder of LTI and your host, Dr. Jason Rountree.
Welcome back to the Laser Therapy Institute weekly podcast. My name is Dr. Jason Rountree, and I'll be hosting you today. We've got a special edition of the podcast today where we sit down and talk as healthcare providers about foot conditions, some of the many things that we will see commonly in clinic. LTI is really committed to making sure that we can help educate providers and then help you leverage laser therapy in your practice to help patients with really difficult cases. So I think you'll enjoy this recap on anatomy and problems that can occur in the feet and how we use laser therapy to address those. I think this will be kind of good, kind of fun. So we're going to be seeing a lot of new foot pain patients here over the next month. I know you're gone for a little while coming up soon, but over
Why
the next
is that?
month, because we ran an ad on Facebook that
Oh.
hit. Just looked at foot pain. I ran a knee pain and then I ran a foot pain, and the one for foot pain just exploded. I mean, it was crazy. Yeah, we got like 3 times as many people.
Wow.
At least.
You mean asking questions or?
Yeah. So on the ads, they can sign up to get more information to sign, and then we get their like first name and their email and stuff like that. And so we got just tons. Like in the first 24 hours, we had like a dozen people.
Wow, really?
Or
Wow,
more.
that's exciting.
Yeah. So I don't know what it was, but it really hit well. And so we've got a lot of foot pain patients. We've got a lot of knee pain patients right now too from those ads we have run. But I thought this would be good to go ahead and go over foot pain stuff before we start seeing a whole bunch of these. Just because I gotta admit, if you told me to point out the cuneiform bone, I'd be a little bit unconfident. So, is that a word?
Navicular, I don't know. Navicular, I know. Calcaneus, I know.
Yep.
Talus.
I get mixed up on these guys.
Oh, yep.
So medial cuneiform, intermediate cuneiform, lateral cuneiform, and that shouldn't be too hard. But I always get mixed up with, is the cuboid on the lateral side or the medial side? I don't know why. I always do. So cuboid, of course, is lateral. And then you've got your metatarsals that go out. This is where we see a lot of stress fractures with people. On the metatarsals. Of course, with stress fracture, you're going to look at like pinpoint tenderness. Not always. You won't always have positive x-rays. So a really good thing to do if you think we are probably looking at a stress fracture is ultrasound. It's not bomb-proof, but ultrasound plus an x-ray together will do a good job with being able to find stress fractures on the metatarsals pretty well. So that's a good one, but I want to start with bones because bone structure I think is really important. When you get into the ligaments, let's see if I can enlarge that. Ligaments are really critical too, and this is the one that is injured the most, are these lateral ligaments. So on the lateral side, you've got 3 really important ligaments that are fibula to talus, fibula to calcaneus. And those are the ones that are typically torn with a like ankle rolling injury. A lot of times they never recover, and people do just really pretty well, or they seem to, but it introduces a level of instability to the joint, and the foot starts to move improperly. A little bit less frequently injured are the deltoid ligaments on the medial side, but these can also be injured too, especially with like sports injuries. And that definitely induces a whole lot of overpronation and instability in the way that the ankle and the foot move. So those are ones to think about, that somebody could have had a, complete tear of a couple of these ligaments on the lateral side of the ankle, and they might not really have any particular symptoms, other than foot pain. It won't even be at the ankle. It could be the foot, could be fibula, it could be knee pain even.
Okay.
So something to think about. This starts to have to do with shape of the arch over time as well. Everybody has their own arch shape kind of genetically, whether it's high or normal or flat, but there's other factors there too, and the ankle injuries play a big part in that, because if you're overpronating constantly, you're going to end up with more of a flat arch, lower arch. because it's just part of losing some of that support. If you do that enough, then you can lead to, those progressive movement disorders can start down that degenerative change in the foot, and not just arthritic changes, but everything from neuromas to bunions to, traditional osteoarthritis. So you can evaluate the gait for weakness in those ligaments just by standing behind somebody and watching them stand barefoot. So I'd highly encourage all of us to, if we're looking at ankle and foot injuries, look at somebody in their socked feet at least. You can just have them stand. I mean, if you can have them walk too, that's even better. But look at this angle here and evaluate, is it pitching too far out? Are they pitching in? You see this one a lot. And you'll also see like more toes poking out on this side as well. They turn those feet more laterally. Sometimes people are in shoes that mess them up. Sometimes people are really in good supportive shoes, and that's the only thing holding them together for their gait. So wouldn't hurt to evaluate them.
Okay, we can do that. So, and maybe this is what we're about to address. Going forward, how do you correct for these things? Maybe that's what we're about to address. Okay, never mind.
Not so much on the... I would just kind of roll through more on the conditions, but as far as addressing this stuff is pretty rough. This is where you need to get some good insoles involved. That's going to support the arch, because if you can support the arch properly, then you don't get this rolling in, because if you've got good arch and the foot sets more properly, if the arch is dropping out from under you, you're going to end up rolling in more, and then you get this kind of angle.
Right, gotcha.
So good supportive insoles does not have to mean, in most cases, some huge $400 set of custom built orthotics for people. A lot of times just an over the shelf, over the counter set of insoles is plenty.
Okay.
Super feet are great ones. They provide good support. They're not too expensive, and they have both high, middle, and flatter arches. Orange super feet are the really high arch. Orange get these really well. Green is normal, and then blue is more for the lower arch. And people can try them on if you go somewhere like Sportsman. You can try just setting the support on the ground and standing on it and seeing how it does.
Okay.
And that's easier for us to do too, because we can just put that on the patient and say, look, you need some insoles, try out super feet, try out the green ones, try the blue ones, try the orange ones, whatever feels comfortable. And then that way we're not stuck trying to evaluate shoes and orthotics.
Just pass that on to get them taken care of.
If somebody is really bad and you're convinced that we're not going to be able to correct, if it's some complicated, then that might be a good time to go ahead and refer them to an actual podiatrist. So the more you have this improper gait and this improper pronation pattern in the foot, the more you put strain on the other parts of the foot that are not designed for that strain. And when you do that repetitively enough on any body part, it's going to develop problems. One of the problems is Morton's neuromas, which again is a great one to use diagnostic ultrasound for. You can't really see this one on x-ray in most cases. Sometimes you'll see a little bit of a widening between metatarsal 3 and 4. But most of the time you won't really see good evidence on x-ray. So diagnostic ultrasound is a great one though. Of course, MRI is another good choice here. This one, patients have more generalized pain in most cases, but you can really nail it down. We've seen plenty of these. You can, if you start digging in there, they'll do one of those. But that nerve is fairly deep. Think about it. It's not on the surface. It's actually lying right in between those two bones. So you almost have to dig in there. These can happen between 2 and 3 or 4 and 5, but between 3 and 4 is the most common location for them to pop up. And that's really going to be a lot of forefoot pain more than anything. Whereas when we go to plantar fasciitis,
our favorite,
everybody's favorite, you really don't have that much in terms of forefoot pain. It's really, really rare. This is an incidence chart on how often patients report pain in different parts of the foot with plantar fasciitis. So the most common location for plantar fasciitis is going to be the heel and then that medial part of the arch. And we've seen this in different spots kind of around the heel too, not just dead center underneath, but even, towards the medial side or a little bit towards the lateral. But your Morton's neuroma is going to be much more out in the forefoot. Another thing here if we're looking at the medial side of the ankle, you've got the tarsal tunnel, which is very much like the carpal tunnel, only it's wider and more open. So you don't see tarsal tunnel problems nearly as often as you do carpal tunnel, but it's the same mechanism of injury. It's the same type of problem because you've got this repetitive strain that happens. The nerve can become entrapped, and then you have all kinds of pain, numbness, burning, tingling, stuff like that. How do you distinguish this from neuropathy?
Test it.
Test it. It's only going to be one-sided in most cases, right? Yep. Also, it's rare that it will go above the ankle.
That's disgusting.
So people who are extra pronated, probably more stress on that as well. It's
Exactly.
just a stretch on that ligament.
Yeah. And you think about, you can have an ankle injury that leads to overpronation. 30 years down the road, you run into this. So
That's really interesting, like you said, distinguishing, like, is it neuropathy or,
and it can be both.
Yeah.
We've had a patient that had it on both sides, went undiagnosed for 40 years. Horrible amounts of pain. Nobody could figure anything out. We figured out what it was, but at that point he'd had it for so long, there's only so much we could do. But really, really unusual, presented just like neuropathy or plantar fasciitis. He was told for years he had plantar fasciitis. He had
Really?
cortisone injections and everything, and they never did anything at all.
And he presented like plantar fasciitis too?
A lot of pain in the medial arch and on the heel. But as soon as you went and you did Tennell's, tapped right in there on that tarsal tunnel, bing, pain right down that whole medial side of the foot. Tennell's is really clear because it doesn't affect anything else down here unless it is nerve entrapment. Another degenerative change is the bunion. This one happens over time, but can happen actually fairly quickly, and you actually get migration of that first digit across. So it's not so much that the end of the toe is going anywhere. The toe itself is fine, but it's that proximal joint that has that lateral transition. So you get widening between first and second metatarsals, and then you get that translation across there. Really most problematic with certain shoes. So you're going to see this with women a lot more than you will with men, just because women wear weird shoes more often than men do.
And so it's an improper fitted shoe over time?
That can start it, yep.
Oh, okay.
That can definitely start it, but so can this improper motion of the foot too, because you're applying more lateral pressure. If you're overpronating, you're pushing the foot out this way.
Right.
And then if you're even in just a regular shoe, the toes are...
Over time, yeah. Gotcha.
Yep.
I see.
So, obviously this is not something we're going to reverse with laser. So that's where you really have to get in there and work with ankle strengthening, because you want to stop the process from going on and try and reverse that improper motion. But then watching the shoes, you know. The thing with these two is that bunion surgeries typically don't go very well. I mean, a lot of foot surgeries don't go well because it's the feet. They're hard to work with. But bunion surgeries in particular can be really, really difficult. And this guy, what's this brace for?
Hammer toe.
Hammer toe. Yep, exactly. So some of us, if we're really lucky and amazingly talented, have this second toe that's longer. And it does create problems, especially if you don't have properly fitted shoes.
It's so funny. I see, just in general, in the general public, most everybody has that second toe longer than the first or third.
That's what it feels like. So these braces can be really useful if somebody's already got that hammer toe development. But again, proper shoe fitting and proper motion of the foot is really, really important here. And that's why, in my opinion, getting foot problems addressed properly, like when we have a younger person in here with an ankle sprain, it doesn't really matter if their pain levels are down. We want to make sure that we're correcting that motion as best we can and using laser to help drive tissue repair in those damaged areas. Because just because it doesn't hurt doesn't mean that ligament is actually
repaired.
Right. So, but if we're already to the point where we need things like these braces and all, there are good tools out there. So, this is the last one, and this is the one that we see tons of: arthritis and heel spurs, calcaneal spurs and Achilles spurs. Those are all really difficult. But those all are the result of improper repetitive loading.
Really?
So,
I was just going to ask you that. So unsupported loading, what do you mean improper loading?
repetitive inflammatory loading in a way the foot's not designed to work.
Okay.
So either improper footwear, or you've got
gotcha.
You've got shoes that don't give the proper level of support because of that prior injury. Lack of strength in the foot even can do this, because when you don't have good muscular strength, that foot tends to just flatten out more than it should with every step. If you do that every step, it starts to strain these attachment points, and the body's response to that is very simply to make them stronger. And the strongest thing it can do is turn them into bone. It has its own problems, but it's your body's best bet on there. Just because they have bone spurring or degenerative joint disease or whatever's going on, that does not mean they're hopeless.
Right.
There's a lot that can be done in the non-surgical realm, and laser's perfect for that, obviously. But that's where we see sometimes need for injections too. Yeah.
So, okay, so I understand the loading on the foot where the arch is, where the plantar fasciitis often develops. What about the attachment of the Achilles, though?
So what do you do as soon as you start getting heel pain?
Tippy toe.
Yeah, and that starts to
Shrinks it
shorten
up.
and applies different stress and more stress than you're supposed to have back here.
Gotcha.
So you start to get the ossification of that attachment side of the Achilles.
Gotcha.
Yeah.
Lots of stiffness.
Yep. So in a case like this, if we got plantar fasciitis, you know it's been going on how long?
Lifetime.
Yeah, a long time. You don't get to this point overnight at all. But we also know that it's not just plantar fasciitis. We know there's other problems going on. That's why we've got the new plantar fasciitis settings too, is so we can work on the associated areas while still addressing the pain. But you can't just focus on that heel. It's not enough. You've got to be able to hit everything else too. That's why our plantar fasciitis settings don't work down here. They start up in the leg. They include the entire ankle, because the entire ankle is almost always a factor, and then you get down here as your very last step.
Gotcha. Okay. And we need to correct the loading, correct?
And we need to correct the loading. It's like a diabetic with neuropathy. If they've got
Right.
uncontrolled sugars,
Right.
you're not going to get anywhere with them. If you've got a foot that's not moving properly, it's not supported properly, and you just keep doing that, it's going to continue to get irritated with every step they take. Now, between laser and injection and stuff, we can do some amazing things despite improper foot motion. So that's great, but the more we can do to properly support the foot, the better. So it wouldn't hurt to stand them in their shoes,
Right.
see what they look like, and then get them shoes off and see if they collapse in or what they do.
Okay. Interesting.
I was just gonna say on that note, it's just looking at the heels of people's shoes, just looking at the wear
Yeah.
pattern. Like cowboy boots are like you can't cheat
Notorious,
them because they'll
right.
wear perfectly on that flat square heel, and you'll see that not as much in like a tennis shoe, but somebody comes in and they got foot pain, they're wearing shoes that might show that good to look at, because it's pretty telling.
It is.
Yeah.
Yeah.
And then that translates to knees, which could translate to hips, which could translate to backs, blah, 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 blah. Okay.
Absolutely.
Gotcha.
Yeah. Especially if it goes on for long enough. And that's what we usually see, is people who have already tried lots of other things and now they're here because nothing worked.
Right.
Yep. Okay, so that concludes today's episode. I hope you enjoyed being able to listen in as we talked about common foot conditions and how laser therapy can be used. If you want to know more about how to implement laser therapy in your practice, if you're a podiatrist or an orthopedic doc or a chiropractor or anyone who commonly sees foot problems, you know how frustrating it can be to not have quick, excellent answers for patients who have been dealing with especially chronic issues. Get a hold of us. We can help you learn how to use laser therapy in your practice to help these patients that are in need. Thanks very much for joining me, and I'll see you next week.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.